This is general information for administering PO meds. This information will be very helpful when you check off on your PO med checkoffs. As a nurse, you're legally responsible for the safe and therapeutic effects of a drug. That means, do I know the right dose? Do I know how it's given? Are there any special precautions I need to know, like contraindications or adverse reactions? And what do I need to teach about this drug? Before you give drugs, you need to figure out a way to locate the information on each drug. Consistently calculate the drug dosages right. Devise a method for giving drugs with the 6 rights. Know the nursing implementations, nursing considerations, or nursing implications, because those are information that you as a nurse needs to know to be able to give this drug. Things like digitalis or digoxin, you need to know what his pulse is before you can give it. If it's less than 60, we can't administer that drug. We also need to know maybe what kind of labs go with this. What was his dig level, or what was his potassium level? So nursing implications tell you that. You need to know that elderly break down drugs slower. NSAIDs, which are Tylenol and Advil, can cause GI bleeds. When an elderly person has a low blood pressure, he's probably going to fall. So we need to keep track of his trends on blood pressure. He'll get a greater chance of dehydration if we're using diuretics. His kidney function, if he's got less kidney function, will cause toxicity in some drugs. He has a greater chance of choking. And if you have a patient that's had a stroke, then you need to put the meds on the strong side of his face, not on the side that he might pocket. Children and infants, on the other hand, need lower drug doses. And their doses are calculated on their age, size, weight. The doses are not standardized. Use a dropper or syringe so that you are precise. And if you need to crush it, you can crush it and give it in food. But don't give it with their formula or their favorite food. They may never want to eat it again. And then when you've given a drug, explain it to them, praise them, and reward them. We have 4 types of orders. Standing, which are routine. Like in the hospital, we call those routine. They're given twice a day or once a day or whatever. PRN is as needed. Those are pain meds or nausea meds. One time means we're going to give it once, maybe pre-op before surgery. And stat means we need to give it right now. New antibiotics, when we have an order for them, have to be given within an hour. And at both hospitals, there is an icon on your electronic health record that denotes that there are new orders that you need to look at. Okay, assessment data. Is this drug necessary for this medical problem? Maybe it's the wrong drug. Are there any contraindications for giving this drug? If it affects the vital signs, you need to know what the vital sign trends are. And some drugs have narrow therapeutic ranges. Coumadin, potassium, digoxin, all have narrow therapeutic ranges. So we don't want to get outside of those ranges. So those you really need to keep an eye on. Also, you need to know, can this patient swallow? If he can't swallow, we've got to figure out another way to give PO meds. And by the way, PO means by mouth. Per os is the Latin word. And are there any adverse reactions from the previous dose? Antibiotics can cause itching, they can cause hives, so all drugs have some sort of adverse reactions, so you need to be familiar with those. Planning. Look up any drugs you don't know. We keep drug books at the nurse's station for that reason. And then also be sure you look up, what do I need to teach the patient about this drug? Implementation. If you prepare the drugs, you give them. At the hospital, at times, nurses will get busy and they'll say, will your student give this drug? As long as that drug's in its blister pack and we can do our own 3 checks, yes, we can give those drugs. But if it's drawn up, poured out, you can't tell what it is. They may tell you, well, this is insulin, and it's in an insulin syringe, but we can't tell that because we didn't see the bottle. We're not going to give it. Medications can't be left at the bedside unless there's a doctor's order. The exception to that are creams for skin breakdowns. We usually keep those at the bedside, especially if they're in isolation, because they don't want to carry those germs out. So we leave those at the bedside. Narcotics are a locked up drug. Every time the drawers open, we have to count them. You have to check your MAR, which is your medication administration record, against your doctor's orders. When we're handling drugs, it has to be an aseptic technique. Wash your hands before and after. If you drop a pill on the floor and it's in its blister pack, then you can use it. If it gets dropped on the floor and it's opened, we have to waste it. Be sure you know what your patient's allergies are. Know their latest labs. And you're going to use all 6 rights on every drug given. And all 6 rights and 3 checks, that drug's been checked 18 times. So you're doing a lot of checking. The right drug, you want to check the MAR against the doctor's order, expiration date on the back of the package. And if a patient says, I don't know what that pill is, I've never seen it before, tell them, I will check to make sure that this is the right pill. Don't give it. The right dose, compare the med with a MAR or drug book. Know the milligrams or grams or micrograms. Those are all different dosages. And some pills that come out of our formulary at the hospital, they don't like to carry several different dosages. So they may just carry it in 1 dose and you may have to give 2 pills, or maybe you'll have to cut it in half. The right route, can they swallow? Can this tablet be crushed? Now, tablets that can't be crushed are enteric coated, extended release, anti-neoplastics, spanchules, the capsules with the little tiny beads in them, sublingual and buccal. And right time. At both hospitals, we have a 60-minute window, an hour before, an hour after, for it to be considered on time. The right patient, we do the right patient by checking 2 patient ID. If they can tell you their name and date of birth, you can check it against your MAR or your Pyxis slip. If not, then you need to take the slip and physically look at their ID band and check their name, date of birth, and visit number. Check their allergies. It'll be on the same bracelet on their wrist, just like their patient ID bracelet. And the right documentation. Date, time, drug dose, route, and when you log in to the computer system, it is electronically signed when you hit the sign button for medications. PRNs, it's on the MAR, you'll sign it there. but it also needs to be in nurse's notes because that was something that was unusual. It's as needed, and there had to be a reason for it to be given. You have to document any adverse reactions. And if a patient refuses a med or it's held for a reason, you need to put that in your nurse's notes. We have 3 types of medication administration. Stock or routine, it comes in a bottle, you pour out however many you want. Unit dose is packaged by a single dose, which is what we try to use at the hospital. And then a prescription, which would be like what your doctor gives you to go to Walgreens. Multi-dose vials, which are something we draw several doses out of, you need to check it 3 times, and that's when you get it out of the drawer, when you draw up the drug, and when you put it back in the drawer. Insulin is a good example of that. All drugs ordered before surgery are canceled post-op and have to be reordered by the physician before we can give them. Sublingual nitro is used for chest pain, and that drug we can give 3 times every 5 minutes, and if that does not help, then you need to instruct them to call 911 or call the doctor. Types of oral and topical meds, we've got tablets, capsules, spansules, enteric-coated, elixirs, lozenges, sublingual, buccal, syrups, and suspensions. Now, syrup would be like Robitussin. Suspensions are like calamine lotion, needs to be shaken. Syrups don't need to be shaken. Topical, we have lotions, ointments, creams, tinctures, drops, patch, inhalants, suppositories, and metered dose inhalers. All of those types of drugs and routes may be in your medication administration checkoff. Okay, that's all.